Hello, I'm Peg Bolgioni, Marketing Communications Manager for Southern Vermont AHEC, and I'm pleased to welcome you to Let's Talk. Our programs are focused on topics surrounding health workforce development in Vermont. Today's show will spotlight community health workers. Southern Vermont AHEC is a nonprofit educational organization dedicated to growing and sustaining Southern Vermont's health workforce, especially in our rural and underserved communities. Welcome back to our show. I'm very privileged to have a very interesting panel of guests with me today, and I'm going to start by introducing them individually. Katina Cummings, Project Director for the Vermont Community Health Worker Workforce Initiative with Southern Vermont AHEC. Jen LeFebre, Community Health Worker, UVM Extension Bridges to Health Program. And Tom Dougherty, Director of Community Health at North Star Health in Springfield, Vermont. Glad to have you all on the show. Glad we were finally able to put it together.
Thank you. Thanks so much.
So we're going to jump right in because we have a lot of things to cover. And Katina, I'm going to start with you. Just to give some context to what community health workers are, why don't you explain a little bit about what a community health worker is and what they do?
Sure. Thank you, Peg. Great to be here with such a terrific group of folks. So community health workers are the new American public health workforce. And the biggest opportunity these days in healthcare is the push to community, partnering with the community. And they're one-of-a-kind public health and healthcare workforce. They're truly unique in that they come from the same communities that they serve. That can be geographic, for example, but it also can be if they come from marginalized communities or those that are disadvantaged. They have a sharpened social lens. They address unmet social needs through culturally responsive approaches that impact people's health. They work both in the healthcare world and they also work in community-based organizations. Mm-hmm. They can work in places of worship. They can work in schools, and they do in Vermont and elsewhere. They are cost-effective, they're patient-centered, and they reduce chronic disease, and they are the kings and queens of prevention and primary care in Vermont and elsewhere. So they're predominantly composed, as I mentioned, of those same marginalized and minoritized communities that they support. And they have been around in the United States for over 60 years, starting with the tribal healers in our Native American populations, and also during Reconstruction and during slavery and Reconstruction with Black healers. So I'll stop there. And
No, that's great. I mean, I'm learning. I had no idea that the history went back so far. Yeah. That's very impressive. So can you give us a little bit of background about how the project, the Community Health Worker Workforce Project, began in Vermont?
Yes, I can. So while I was at Northern Vermont AHEC as the CE Community Education Director there, I was asked to participate in the State Community Health Worker Steering Committee, which is organized and run by the Vermont Department of Health. So I've been on that steering committee for over, I think, 5 years now. And the State Department of Health recognized our contributions to the work on that steering committee, and also decided when they received notice of the federal government's investments in community health workers, they wanted to advocate the CHW workforce and build that workforce. So they naturally came to us in 2021 and said, we would like you to help elevate this workforce in Vermont through training and other strategies. So since then, I've been with Southern Vermont AHEC since February of last year. And we've started this project, and it's continuing to this day. I like to say that this is a movement and not a moment, because it's a unique time nationally as well as in Vermont that this workforce is rising to the value that it deserves.
All right, excellent. So Jen, I'm gonna direct this question at you because you're boots on the ground, you're out in the community, you know, this is your work. This is what you do every day. So can you just describe to our audience about what you do in your role as a community health worker?
So the program that I work for is called Bridges to Health. It's a migrant health program, and I think that word bridge really describes the work that I do. My clients have health needs, as we all do, and but they need that bridge to access them. So a lot of the work I do is, helping to make appointments, providing transportation for people to appointments, providing interpretation. We have, our clinics and hospitals that receive federal funding are required to provide interpretation services, but it can be a little clunky. A lot of them in southern Vermont are via tablet and having someone on camera, and there's, it's delayed. It's just more challenging, and so having someone there in person to provide that interpretation is really useful for both sides. And then also, then comes the bill, and people need assistance navigating that. And I help apply for insurance or financial assistance for those that are eligible, and setting up bill pay systems and food access. So it's lots of different things, but it all could be kind of described as acting as a bridge to help people access what's available.
Yeah, bridge building. Yeah, it's exactly. I remember Katina, we mentioned that quite a bit when we talked about CHWs.
Yeah. Could I add to that?
Yeah,
Thank
of course.
you. Just quickly, that bridge is the central role of CHWs, and the bridge is also between medical healthcare people and providers, as Jen was saying, and also between health and social services and the community, because it is so unique. What makes CHWs unique is not only their connection to the community, but they actually work in the community. So if they find out, for example, that people have, some of the people they're seeing have an asthma issue, right, and they live in the very same community, or they're going to the same school, they might go to that school, or they might go to that apartment building or that home and find out other people have asthma conditions because they are living in a place where there are air problems that are causing that asthma. So they see the individual in the context of their home and in their community, outside the walls of a medical facility, not exclusively, but at times.
Well, Tom, I want to bring you into this conversation. What, as an employer of community health workers, what do you see as the value that they bring to patients in your organization?
So, Jen set it up great, because that bridge, right? So it can be very challenging within the healthcare setting, right? You go and you see a doctor or a nurse. They're very specific to what they need to do. Their time is limited. There's more people that need to see them that they can see, and so it's very important today to have someone who can be outside of that setting or connect people to that setting to what they need, whether it be at another hospital or a clinic, or whether it be to one of the community services or groups that Katina was talking about. So it's such a critical role, given how complicated it can be right now, right? If someone has a chronic condition or has multiple barriers, whether it be all the things that Jen mentioned, so transportation, a lot of people can't get somewhere, or technology, if they're going to have a virtual visit with someone, a specialist who's hours away, and someone who can help even provide a laptop or that connection and ability to see that person virtually. So in all of those ways, it really is a service, a role that enables someone to take the benefit of the health services that are available.
So how do you recruit CHWs into your organization?
All the usual ways, right? So online and posting on social media. We also really try and talk it up within people in the community. So for our organization, so North Star Health is a federally qualified health center. We have a lot of strong connections with community organizations. Those could be churches, food shelves, community action organizations, housing programs, all of those people rooted into the community. So we need to let them know, right, who we're looking for and that we have an opportunity. There's often libraries, and I mention libraries because libraries have volunteers, and volunteers are people who often are ideal candidates to be a community health worker because they have taken a step to be of service to their community. They've found they can learn something. They want to help, and those are some of the key attributes that we look for in a person who wants a job as a community health worker.
All right. And Jen, I just wanted to ask you, as a community health worker, what qualities do you feel you bring to your position?
So as Katina was saying, community health workers are generally from the communities that they're working with. I'm not part of the Hispanic communities that I work with, but I speak the language. And I work really hard to build trust with my clients. I have a deep affinity for them, despite not being part of that community. And I think that they can feel that. And, a lot of the stuff that we're working with is sensitive personal stuff. And so building that trust is really important. We go to people's homes. Medical providers don't have a lot of time to spend with clients, and we're able to take a little more time to build those relationships.
Right.
So,
Katina, did you want to say something about that?
That's
or?
just so key. That's really what distinguishes a community health worker from many others in the traditional medical model, is that community health workers have that trusted relationship because they have developed relationships with the people that they serve. They know them differently than providers because they do have the time to do that, but they also see the patient or the individual holistically. They see them in as a whole person, not just a particular need, but all their needs. Maybe the barriers that prevent them from getting primary care. Maybe they're homeless individuals as well that have more than medical needs, right? They have other needs, as both other guests were saying. And they're a versatile group. Community health workers can do so much. They provide advocacy. They are advocates for the communities they serve. They do health outreach, as Jen was saying, both in homes and community settings. They do informal counseling, and they can even provide some direct services, such as blood pressure checks and so forth, depending on the needs of the facility that employs them and also on the populations that are served. So it's a tremendously versatile population, or I should say workforce. And the federal government has recognized this because during COVID, it was community health workers that were instrumental in helping get people who were not getting vaccinations, especially those in underserved communities, vaccinated, dispelling their fears and their myths because that trusted relationship allowed them to pull down those barriers.
Well, I mean, that's very true. And what I wanted to ask is the career pathway of a community health worker. It doesn't sound like there's a direct pathway per se. So how would somebody that was interested in pursuing this type of career, how would they go about getting started in it? I mean, I'm just curious about that. Does anybody want to take that question?
I think they do what we often do when we're looking for opportunities. We go online, right? And if you Google community health worker in Vermont, I would hope you would find a lot of postings would come up or connections. There's a newsletter that also has listings, but really to think about, hey, I enjoy helping people. I mean, as you become aware of what's of interest to you, I think of people who might have had an opportunity to care for a family member or a friend and found they like that, and they gained some real key knowledge in being that advocate and helping people navigate different systems. And then they might find themselves, I don't have a degree in social work or specific training, but I like doing that, and think that actually that's perfect background and experience to become a community health worker in many settings. So I think it's acknowledging or recognizing that in yourself, and then talking to people, going to your local community organizations, healthcare providers, and saying, hey, are there opportunities for me in a role like this? And I think, knowing from everything that's going on in Vermont right now, there'd be a lot of people who would say absolutely. So I think it's acknowledging, recognizing in yourself that you have that interest, and then talking to people, going online, and finding out more information.
So, Katina, I wanted to ask you a little bit more about the workforce piece and the Alliance. If you wanted to just maybe let our viewers know what the Alliance is, what you're doing right now, and kind of what you're working towards.
Sure, thank you. The Community Health Worker Alliance is a group of volunteers in Vermont, and these are community health workers, and Tom and I are community health worker allies because we support the development of a community health worker network in Vermont. And so we formed in January of this past year for a couple of main purposes. One is to elevate the profession through core competency training and other trainings, and to develop, by the way, a career path down the road. Secondly, we have been reviewing our core competencies in Vermont to create a Vermont-specific or to adopt from another state a Vermont-specific training, because CHWs in Vermont do not have a standardized training based on their core competencies. So this alliance is giving voice to community health workers, building recognition between themselves, their peers, and also with CHW allies.
Okay, very good. So let's talk a little bit about the roadmap with the grant that we received, the Southern Vermont AHEC received to develop this project, and let's look down the road. What are the goals, and what do you hope will be the outcomes?
I think we've accomplished a number of our goals so far in a pretty short amount of time, and again, focusing on developing this career path, but starting with training of Vermont CHWs, but learning also what is the CHW landscape in Vermont. Many CHWs, or I should say many people who fall under the CHW umbrella, like peer educators and care coordinators and others, sometimes they don't really know that they are CHWs. They tell us that all the time. They look at the roles and they look at the skills and they say, well, I'm really a CHW because I'm in the community part of the time and I'm doing all of these connecting roles and I have these trusted relationships. So we want to continue to build the workforce in the Alliance. And we want to help establish a standardized training program for CHWs that will lead to eventual credentialing. And the Alliance will probably soon, at some point, because community health workers have told us they want to do this, form a formal association to provide peer opportunities of learning and support across the state. So those are some of our upcoming goals.
All right, excellent. So Jen, do you believe that CHWs are becoming more accepted in the healthcare workforce? I
do, yeah. I think, organizations like Southern Vermont AHEC are getting the word out. I find in my own experience that our work is really valued in the medical offices and hospitals that I visit with my clients. I hear all the time how appreciative people are. They see the value in that bridge, especially my role is a little unique in that I'm providing interpretation. But I think, like I was mentioning earlier also, the way we're able to spend more time with clients, sometimes we're helping them with like motivation to take care of themselves or to follow through, to show up for appointments, which obviously reduces healthcare costs when clients aren't missing their appointments, when they're taking their meds as prescribed. And so having that support, I think, is really valuable for everybody involved.
Tom, what do you feel? What are your thoughts on that?
I second everything Jen said. We wish there were more community health workers. We look for people to provide that bridge, that role, that assistance, and we're very fortunate to have some within our community health team. So it's an incredible extension of the nurse and the PA or the MD and that whole team. We can't do what we're trying to do or to help a person do it without those other resources in the community and resources that don't come with a bill, right? That can go to the patient. So as Jen mentioned, part of the thing she does is assists with transportation, but also makes home visits, as do our community health workers. That is incredibly valuable to a care team, right? To have that ability for someone to see the environment where someone lives, to be able to go in the home and assist them with things, to help them get to appointments. We have a health center in Ludlow that was put offline because of the floods. And our providers, our doctors moved to Springfield, and we're able to see people from Ludlow there. But guess what? Some people from Ludlow couldn't get there. And so our community health worker was picking people up and bringing them to see their doctor. I mean, things like that, we couldn't. It's like, what did we do, or what could we do before we had these people? And we've had them, fortunately, for years, and we're so happy about this initiative with the state to strengthen them as a workforce, to develop more, because we need a lot more community health workers.
Right. Katina, are there pockets of the state that are still in dire need of community health workers?
My personal opinion is, from all the interviews of speaking with over 300 individuals in over 100 organizations in the state, and these were not just healthcare organizations, that every community deserves at least one community health worker. And that's in urban areas, rural areas, or the small towns, because the needs are so unique. And as we have been talking about, community health workers uniquely allow for increased access to quality care, but they also reduce disparities between urban and rural areas. They allow people to get more preventive screenings and other services. So I would say in all areas, and I can comment on rural areas as well, as if you'd like. The Surgeon General just announced, we didn't have a chance to talk about this before the show, or this was in late May, that social isolation is now an epidemic in this country. And he is advocating more social care based on relationship building, that those services are as important as, for instance, finding out about cancer screenings. They are equally important, not more important. And so community health workers are uniquely positioned to be that link, especially in combating social isolation and loneliness.
Yeah. Do you work, Jen, with a youth population?
I have a lot of families that I work with, so I assist with, pediatric appointments and things like that.
Okay, all right. No, I was just thinking to Katina's point about the social isolation, and I've been reading myself about, since the pandemic, the mental health issues with young people have just skyrocketed. And I'm sure that has to be something that you're dealing with on almost a daily basis, with your clients. So I'm just wondering.
Yeah, I don't have a lot of teenage clients. I know a lot of my clients feel very isolated due to language and lack of transportation, especially those on rural farms. And just looking for community. A lot of them are coming from, communities, cultures that are have deep roots in community and family and connection, and so that's definitely something we're seeing.
So Tom, do you feel confident, going forward, that the CHWs will become a sustainable workforce in the state? Or?
I'm hopeful. So a big thing is, as I mentioned before, community health workers don't come with a bill or a fee. So there isn't revenue generated by their services, right? So that makes it more challenging.
Right.
And where we look for other resources. We're very fortunate in Vermont to have the Blueprint for Health through the Department of Health Access, which gets funding from the different payers, private and public, to support community health teams like the one in my organization, and that enables us to have some funding for CHWs. That's great, and that's unique. But then there are grants, we have others on grants, and I know part of the work that the Alliance is doing is trying to make those funding streams more permanent and to expand them, and there's a desire to do that in Vermont. So with all of that, I'm very hopeful.
How do you feel about that, Katina?
Oh, I'm hopeful too, and I will say that I'm so glad you mentioned the Blueprint for Health, because there is now a recognition recently with the Blueprint for Health, and the legislature voted to expand the community health teams with additional funding, which would include the hiring of community health workers. So we're very excited about that. Right now, I will say that community health workers are underutilized in community health teams. There are not many, but they are expanding now with this infusion of funding and the leadership of Dr. Saroyan and his team. We have a lot to do to make this workforce sustainable, and Medicaid reimbursement is one avenue, but there are many other avenues. And I will say the partnerships that develop between the private and the public sectors and the payers and our alliance, that's one of the key solutions to make sustainability of the workforce a reality.
I'm just curious, how do we measure up with other states in terms of community health workers? I mean, obviously some of these states have larger populations and maybe they've been doing it longer. I know that's there's no quick answer to that, but maybe in the few minutes we have left, one of you can speak to it, or...
Sure.
Well, Katina has been looking at this from a national perspective.
So we are, I would say Vermont is in a stage of growing community health workers, but we are at the beginning, really, of organizing this workforce so it becomes sustainable and valued, as Jen said, in the way that we know. These are essential, critical infrastructure workers deemed by the U.S. Department of Labor, the ACA, and deemed by national experts that we need to have on a permanent basis in our public health workforces. I would say, Texas has had community health workers for over 40 years. A lot of the southern states, the more diverse states racially, have had community health workers. So we have some catching up to do in terms of training, in terms of credentialing CHWs, and in terms of having them recognized for the value that they bring, both financial and to the patients that they serve. So we have in Massachusetts, their training program that, by the way, we have brought into Vermont for a pilot project. They have had community health workers supported by the legislature for, I believe, over 20 years. So every state is different, and we have lots to learn from those states. Not that we would adopt their models, but we are learning what the best practices are for allies like Tom and also for our community health workers as we build this alliance.
All right, excellent. So we don't have much time left, so maybe in the next 30 seconds, do we have any final things to say before we sign off? Tom?
Yeah, I would just say hopefully this conversation sparked an interest in people and what a community health worker does, and that people would think about it if it's for them and look for those opportunities.
Okay, Jen, did you have any final comments?
I know, in our organization, we're looking to secure funding. We're grant funded. I think throughout the state, I have 5 other colleagues doing the work that I do. We all have a few, 3 or 4 counties each that we cover. And then my supervisor and my boss also. And it would be great to secure funding to be able to continue doing this work as the immigrant population grows.
Excellent. And Katina,
Yeah,
we've got 30 seconds. So
Thank you so much. We have called community health workers recently, the National Association of Community Health Workers has called them the workforce we need for the world we want. And I think it's the workforce that we need for the Vermont that we want. Vermont is naturally a very relational place. We're a small community. We're a small state, and we have communities where people know each other. It's the perfect environment to build this workforce, to effectuate and create change, not only for individuals and their families and their communities, but on a state level. How care is delivered. Community health workers are change makers.
all right.
Thank you.
Excellent. Well said. So thank you all for being on the panel today and joining us on Let's Talk. And we hope that you continue watching us on our Let's Talk program. Southern Vermont AHEC. You can watch us on www.svtahec.org. Thank you.